Is acupuncture a helpful tool in treating concussion? So again, we get back to what is a concussion. Concussion is an energy deficit within the brain for a very short period of time. What can help that energy deficit? Nothing can help that energy deficit. The closest thing we have right now is potentially on the dietary and supplement area. So things like, anti-inflammatory diet, potentially helpful. Things like fish oil can help with inflammation. I just read a study on ketogenic diet, helping to reduce the energy crisis that happens within the brain. I'm actually going to be doing a couple posts on that coming soon. So I think aside from dietary intervention in that acute stage, and nothing can really help a concussion. It's just the time that's required to do it. Now, can acupuncture help the symptoms of a concussion? That's a different story. So the symptoms of concussion being headaches, dizziness, nauseousness, visual disturbances, and all these other things. There are some things that acupuncture has been shown, or at least dry needling, not necessarily traditional Chinese acupuncture, in full body acupuncture or healing qi and meridian lines or anything like that, but more point specific acupuncture or dry needling type techniques have been shown to do a few beneficial things in concussion patients. And actually there was 3 studies in the past year looking at acupuncture specifically for certain things, and I'm going to bring them up right now. Gotta enter my password here. Don't look, people. Okay, so we got 3 studies. One of them is talking about using acupuncture for headaches. One of them is talking about acupuncture for dizziness, and the other one was talking about acupuncture for improved cognitive function, which sounds strange, but they actually found a positive effect. So the first one, acupuncture for improvement of cognitive function after concussion. This is from an author by the name of Zhang. They had 72 patients with cognitive impairment. I've actually done this one on one of my Instagram posts as well. Both groups, they were randomized to receive acupuncture or not receive acupuncture. Both groups were given oral acetylcholine sodium tablets as part of their treatment, and then one group was also receiving acupuncture every second day throughout the trial, and it was electroacupuncture. The treatment protocol was for 30 days. At the end, there was a significant improvement in cognitive function in both groups. However, the group that got acupuncture was significantly better than the group that did not receive the acupuncture. So acupuncture may improve cognitive function. The points that were used was GV20, which is right on the crown of the head, GB20, which is in the suboccipital region of both suboccipital areas, and the other one was GV17, which is the external occipital protuberance at the back of the head. Those 3 points were the ones that were used, and they were stimmed using electricity at 200 to 300 pulses per minute at a frequency of 4 to 6 hertz. The other one was using cervicogenic dizziness, and they put needles into the inferior oblique muscle in the suboccipital triangle, and I believe they just left it there. There was no stimulation, they just left it there, so it was on either end, right into the inferior oblique muscle, and they just left the patients there face down. This is only a case series of 3 patients, however, varying ages, and they found that after how many treatments? Let me just see. All the procedure and stuff is here. Not sure how many treatments they had. Anyway, cervicogenic dizziness, and the other one was for headaches. So can acupuncture help treat a concussion? I don't think the pathophysiology of concussion, anything except for nutritional interventions or things looked at boosting energy levels and reducing inflammation, are helpful in treating the actual concussion injury itself. But is acupuncture helpful in treating some of the symptoms of concussion? Yes, possibly. Now, these are smaller studies, and there aren't a lot of them, but I use acupuncture a lot for dizziness. I use acupuncture a lot for headache relief, and my patients also find it quite effective.